unfortunately, we will be setting a new all-time high of opioid-related deaths for the state when the 2021 numbers are final. As of right now, 73% of the deaths that we saw in 2021 involve synthetic opioids, primarily fentanyl. It is clearly the driver of what we are seeing.
Fentanyl is so cheap and it's so easily accessible and readily available, and that's starting to really overcome and overtake the west central Wisconsin area. We also need to address the Good Samaritan law, and we need to get legislation passed because that is something that is scaring the general public and those that may be using that are on probation or parole, and they're not taking necessary actions because they're afraid of getting in trouble. Stop having our public, our citizens that are using, become criminals because they have to become criminals before they get the services offered to them. And there's a problem there, and we need to really look at that.
Part of what will happen at the local level is that we will partner with our educational facilities to try to increase awareness and education so we don't have the problem and play catch up when someone needs Narcan or when we're arranging a funeral. And we got to do it earlier.
The education part is important, and again, it's in a context, right? Again, within when the children go home, they're going back to sometimes very dysfunctional areas, and the effects we know from research and from the work that I do is the effects of adverse childhood experience. Leads to intergenerational trauma, leads to the circumstances that Mark, you spoke to, where the situation is ripe for anything to seem like a welcome respite from the reality that people are living.